And coming up on News 2 at 6 o'clock, Roper St. Francis is heading into a new year with some awesome new tools. A look at the new palm scanning technology.
Now, News 2 at 6, the station you can count on.
To your health tonight, the next time you visit Roper St. Francis, instead of sticking out your tongue and saying, ah, you might hold out your hand as a wave of infrared light tells the Roper staff member who you are. It's called palm scanning technology. And Roper St. Francis says it not only gets through to your appointment on time, it protects your identity along the way.
And then right back down.
It may look like something out of science fiction.
Just basically a small scanner that allows us to take a picture of the vein pattern in your hand.
Actually scanning your palm right now.
That vein pattern is then converted into a 100-digit number and then connected directly to your medical record.
But palm scanning technology is making it easier for patients to register at Roper St. Francis Hospital.
Our palm scanners are the new patient identification system that we're using throughout all of Roper St. Francis healthcare system to make sure we accurately identify the patient each and every time they come in and present for a visit.
Near-infrared light does not give off heat and is the same type of infrared light that's used in TV remote controls, so it's safe for frequent use.
We do have patients that have routine tests here, and those where they really see the benefits, where if they're coming in every 2 or 3 weeks for a scan, they can just place their hand on there, and it just really speeds up that check-in process.
And even if a patient is sick and unable to provide the hospital information, if the patient is enrolled in the system, palm scanning will do the talking for the patient.
In an emergency situation where you're unresponsive and couldn't present that information, if you're enrolled in this system, we'd actually be able to pull up your medical record with just using that palm print.
Check in a lot faster.
Charlotte Lawson had no problems using the new system.
It was very simple. Just spread your hand out and take a picture.
And that even applies to children 13 and older checking into Roper St. Francis. And because they are still growing, they will be rescanned each year until age 15.
Make sure I read it correctly. Okay. Perfect.
Providing safe patient care starts with accurate patient identification. And Roper St. Francis says palm scanning is one way to access your unique electronic health record to review your history and document your care each visit.
Just as we become more, a technologically advanced society, that identity and that theft protection is just very, very important. So regardless of whether it's healthcare or, using your debit card at a store, just making sure that we can protect it and make sure that we have your information and it's not transposed with anybody else's is a big concern, regardless whether it's healthcare or business.
And palm scanning cannot be used by law enforcement or the legal system. And since vein pattern recognition requires blood flow, it is not suitable for forensic analysis either. The scan data comes in no use for crime investigations. Now, if you refuse to be scanned, you will still be received by Roper St. Francis through traditional forms of identification.